Palliative care is a human right to health. Palliative care is prevention and relief of suffering by early identification, impeccable assessment and treatment of pain and other physical, psychosocial and spiritual problems. According to the World Health Organization, palliative care is meant to improve the quality of life of patients and their families facing problems related to life-threatening illness. The World Health Organization estimates that 1% of every population is in need of palliative care. An estimated 3.6 million people require palliative care services in Uganda, and just over 10% of them are currently accessing the services.
It's not easy to talk to somebody who is in a lot of pain, because as you're talking, this patient is crying in pain and cannot listen to you. You alleviate the pain and then you're able to counsel the patient. But also, you'll have brought peace in this home, because these people stay with the patient groaning in pain. They are also experiencing pain and they can't be at peace.
Palliative care was formally introduced in Uganda by Dr. Anne Merriman, a physician who had worked globally in the field of pain relief. She started Hospice Africa Uganda, the first specialized palliative care facility in the country, in 1993.
So we did a feasibility study of 4 of the countries who had asked for help, and we chose Uganda for several reasons. One, it was very poor, and yet there was a terrific sense of helping each other. People were caring for each other.
Palliative care is now available in 90 districts across Uganda, in all regional referral hospitals, district hospitals and some health center falls. 12 standalone hospices found in various parts of the country also offer the palliative care services. Ideally, all health center falls should have palliative care services. Right from the start, the big need in palliative care was to bring in oral morphine, an affordable pain management medication for those suffering from severe pain.
The Minister of Health immediately said to me, let's get in that morphine and you start.
To date, free oral morphine is considered the biggest achievement in controlling severe pain in the country.
And now the government are involved with us with a public-private partnership. Now this public-private partnership enables a hospice to actually manufacture morphine for the whole country.
The Palliative Care Association of Uganda, PCAU, was established in 1999 to promote development of palliative care activities in the country. The association coordinates civil society organizations and works with government to develop policies that improve the quality of services for patients.
Uganda was able to allow specially trained nurses to prescribe oral morphine. So in Uganda, really, the nurses are the forefront of palliative care service provision.
Members of the association use different approaches to provide palliative care to those who need it. Home-based care, facility-based care, community outreach, daycare and roadside clinics are some of the models being used. Home-based care is a model of palliative care where a team of providers take the service to a patient's home environment. Hospice Ginger is using this approach to reach hundreds of patients.
Many of the palliative care patients are usually very sick. Some are immobile. Some of them have disfigurements that would not allow them walk to the facility, and the others have issues of transport. Sometimes the nearest health center is so far for them that they can't get there. So looking after them at home, they feel very comfortable because they are near their loved ones. They can easily access everything and they feel loved when you visit them every time at home. And there is a lot of, you're able to do a detailed social assessment because you're seeing the family.
Harriet Logose is a social worker with Hospice Ginger. She is a constant presence in the community, assessing and counseling patients and families in need of palliative care. Today, she is counseling a family whose patient has advanced abdominal cancer.
I encourage her to stay strong for the loss that is coming in the family, to prepare herself in case there are things that she doesn't know about the patient, to find out more details that she may need if this patient is to pass on. Like for that one example, the patient has a child. Sir was trying to help her out, to see if you can locate where the father of the child is.
Joanita Mbavazi, a palliative care nurse with Hospice Ginger, is taking care of a patient with a brain tumor. Since the patient started receiving care, her pain has been well controlled. She was put on oral morphine, which is delivered to her home. Grace Nyandera is living with HIV. She is enrolled as a palliative care patient with Little Hospice Hoima. Grace used to travel to Hoima town to receive treatment for her condition, but lately she has been bedridden. A team of palliative care providers, including a nurse, social workers, and a spiritual leader, bring palliative care services to her home. They come with medication, review her health condition, and comfort her teenage son.
Akwachale mbere indu muti nkusobola kurubata kanti nyina za boda boda za mbani nyeikira nibampeze emibazi baite embabazi za mukama nizo zikubinkolera.
Each patient is unique and each home is unique. So if we find the patient is having a wound, we do other nursing care like dressing. If the patient is not able to turn in bed, we turn them in bed. We teach the carers. That is very important because most of the time we are not there. So we teach the carers how to do certain things. We give them the basic skills.
Grace is a spiritual person. Her needs include regular fellowship and prayer. Since she is confined to her bed, the priest who works closely with Little Hospice Hoima has travelled with a team to pray with Grace, encourage and comfort her.
Abanamba nasabira mfuna obwomezi buyaka nokuba oburwaire bwange bukoleke bukire.
We share the word of God. After sharing the word of God, then I interact with them when they have like some prayer request.
Community outreach is a palliative care model in which providers meet with patients on appointment days at designated places. 20-year-old Alex Seremba comes for outreach at St. Francis Health Center Mbirizi along Mbarara Masaka Road. He has a brain tumor which has damaged his eyesight, and sadly, the cancer has also spread to his leg. Before his leg was amputated at Masaka Referral Hospital, he suffered excruciating pain. After the leg was amputated, he was referred to Chitovu Mobile, which provides an outreach at St. Francis Health Center closer to his village. An outreach conducted by a team from Little Hospice Hoima helps the staff of Chigolobia Health Center 4 in Hoima reduce their workload.
At least today, about 20 patients. If those 20 patients every week or every day they are sitting in the queue waiting to see a clinician without a relief, that's a very big burden. And when the pain is not relieved one single day, the next day the patient is back. It will mean the number of attendances of this patient is going to triple or double in a week. And the physical presence of a patient you see in a line and the time you give is, if it is taken away, it is a serious relief.
At Hospice Africa Uganda, palliative care patients who are cared for at home congregate once a week to socialize and take their mind off their pain. They engage in play and productive activities which help them relax such that they can cope with their illness while their carers get time to rest.
We have a number of activities which creatively engage the patients. These include handicrafts, so they may make cards or mats, candles, or they may be engaged in cooking. This increases their skill, helps them relax, but also provides items which we resell to members of the team and people who come to this campus.
Margaret Nanyanzi Semfuma has spent years coming to Hospice Africa Uganda for day care.
Akati okujja ku daycare kinyamba kubanga otube mbeereko eyo mbeera nga ndiyo bwomu nga mpubadde ebirowoozo byonna nga mbeera n'ebirowoozo bingi naye ate bwe nzijja ku daycare wano kwegamba mpulira nga omutima gwange guteredde tuuse mbaganda bange.
In Arua Hospital, palliative care practitioners are getting a refresher training on the tenets of the practice. PCAU, together with the Ministry of Health, are partnering to provide a service that minimizes suffering caused by pain for patients admitted on its wards. Ronnie Hapamako is admitted on the palliative care ward due to pain caused by leprosy.
My whole body was burning. It going on day and night. After that, I came here. They gave me medication. After that, I've been started to feeling better.
Lucy Agaboro, a nursing officer and head of palliative care unit, makes rounds on the ward to ensure that patients are taking their medication and that they are as comfortable as possible.
You find the patient will tell you, I slept. And in palliative care, that is very great. The relatives say, I slept last night. I didn't sleep the other time. But when the patient was started on oral morphine, I slept. He ate. Those are the great things we like when we are controlling pain in patients. In order to prescribe morphine, you need to do diploma in clinical palliative care, which I did for 9 months and qualified, and I started prescribing oral morphine.
Training for healthcare professionals in palliative care is done by Hospice Africa Uganda in collaboration with Makerere University. Patients faced with terminal illness are often in need of legal aid. PCAU has partnered with legal aid and human rights organizations like Uganda Network on Law Ethics and HIV/AIDS, Uganet, to avail these services to the most vulnerable patients and their families.
They link us to those patients. However, Uganet also has paralegals who have been trained on palliative care, especially to identify legal needs within palliative care. So those paralegals also link us to patients. So their greatest need usually is to settle their life affairs, mostly to do with property and with children.
Under the Road to Hope program, Palliative Care Association of Uganda and partners support vulnerable child caregivers to stay in school. PCAU's education support to child caregivers includes provision of children's fees, scholastic materials, as well as providing psychosocial support. Agrey Lubuya is in school at Holy Cross Lakeview Secondary School in Jinja.
If they have not paid for me school fees, right now I could have stopped studying.
In spite of the progress made in providing palliative care, it is still far from reaching all those who need it.
Where there are no specially trained palliative care nurses, there are only doctors there, it poses a challenge because the workload is so much for the doctors and they may not pay adequate attention to the patients who need palliative care.
But there is a lot of goodwill and commitment from palliative care providers and government.
So palliative care is the big need, and we don't want patients to be afraid. Let them come for palliative care. With the Palliative Care Association now, they have reached 90% of the districts with a person who is trained enough to be able to treat you. So go to them when you have pain, let them know.
There are many families which still suffer, who have patients, who have people who need our services, and they now to come to us. Most times they come when it is very late.
The services are available, the medicines are available, but unfortunately people don't know where to go and access the services. Therefore, encourage the patients to go to hospitals, ask the doctors, the nurses for palliative care services. If they don't have it in that hospital, they will refer you to the nearest hospital so that this patient can access the service.